back to square one. But where are you guys and what are you doing?
At the moment, we are in Columbus, Ohio, but the big picture of what we're doing does go back quite a few squares. 4 summers ago, I rode through the northern tier of the United States from Washington, D.C. to Seattle. And on that trip, I spoke to people about the Affordable Care Act. And what really struck me was how much misinformation there was. People didn't really understand what this whole idea of an attempt at universal health care was. So I said, I'm going to ride my bike. And probably the most important piece of that whole trip was the title that I used. It was the Bike Listening Tour. And indeed, listening was really the critical element. And listening basically means keeping your mouth shut. Stop interrupting people. Stop always thinking that your own agenda is more important than, in my research, the people with whom I was speaking, and in my work, are patients. With the upcoming election, 2020, it seemed most appropriate to go out and talk again. Just tell me who you are, your name, whatever you want to use to help me understand who I'm talking with.
Gary and Sandra Davis from northern Minnesota.
My name is Steel Magnet. I'm from Iron River, Michigan.
I am Colleen. We have lived in Fort Wayne for 24 years and have this bed and breakfast for 23 of those years.
So this time we broadened the themes and conversations to really focus more on healthcare in a broader sense than just the Affordable Care Act.
And I was hoping we could talk with people to explain some of the healthcare policy choices that the different candidates were discussing.
I'm with Bernie on Medicare for All.
A Medicare for All proposal.
We're signing a healthcare plan within 2 weeks, a full and complete healthcare plan.
I'll put your family first. That will begin with a dramatic expansion of health coverage.
We left on May 15th, the day that Governor Ducey lifted the stay-at-home order.
This is a good trajectory for Arizona.
And we drove to State College, Pennsylvania, which is in western Pennsylvania. It was just easier to not deal with planes, with the bikes and everything. So we drove and we started in State College. We went west into Ohio. We took the Ohio to Erie Trail, which goes north-south, and we went from Akron down to Cincinnati. From there, we rented a car and drove to Detroit, where we met a bunch of friends who were joining us. And then we rode up through the middle of Michigan, through Mackinac Island, the Upper Peninsula, and Wisconsin, Minnesota, and ended up in Fargo, North Dakota.
I think it would be fair to say we were in a completely different world. Talking about Trump, how is Trump doing for you in terms of health care?
I think it's unbelievable. There's no other country in the world. They say Sweden, I go to Sweden. Eh? That's socialism.
What about the people who I'm sure you read about in the news who are not as fortunate in having good coverage? How do we do in taking care of those people in this country?
What a difficult question to answer. I'm a greedy, selfish capitalist. I knew I had to work hard to make the money to do the things that I wanted to do, and I did.
I paid for health care my whole life. You know, I paid into the system. I didn't use the VA till I get old. I still pay supplemental insurance. You know, you got to pay something to get something.
There was a man, I remember, we were arriving at our hotel that evening, someplace in northeastern Ohio. There was a Trump re-election paraphernalia roadside stand, and I stopped just talking with this person who was manning the booth, as well as all the people that came up to buy stuff. It was the day we passed 100,000 deaths. Oh, that's not true. That's not true. Those people didn't really die of COVID. It was all a lie.
you just say where you are today, what you're looking at, and also what day you are on your trip.
We are now overlooking either Lake Michigan or Lake Huron. We're at the place where they join together by Mackinac Island. And we are on day 25, I think, of our journey. Today was our rest day. Today we're just taking it easy, listening to the waves lapping on the small beach here in front of our hotel.
I think the thing that has been most striking, for whatever reason, many, if not all, of the people we've spoken with in the last week or so have been much more in the middle of the political spectrum, open to thinking about a national health approach and healthcare as a right.
And things went up, yeah.
We would like to see some public health initiative in healthcare for all, really.
They talk a lot about the pharmaceutical industry and the healthcare industry and see them as a real problem, lobbying being the main issue that keeps their elected representatives from representing them as opposed to the healthcare lobbyists and the like. We're back on the other route now.
We have about almost a mile before.
So we have completed 5 weeks of cycling, and we have a little less than about 2 weeks left.
Now we're in this very small town. This is a totally open, warm community, welcoming to LGBT. They teach diversity in the schools. It's just like, wow, how did this happen? And the people here can't really explain. It's just that we've always cared about each other, and it's a small community, and we take care of each other. So it's been very pleasant to be here.
One of the people we're going to interview in a little while, she's a mechanic, and she's a male to female trans person who told us that during the time of transitioning, some of her clients would say, I don't care what you do on your own time, just be sure you keep fixing my car. And that was just a very touching idea.
Yeah, so where are you right now? Where are we sitting right now?
We're back in Tucson. We've completed almost 2,000 miles. We finished our trip a couple weeks ago.
So I realized after a while that my idea of having conversations with people to inform them was probably insane, because nobody was really willing to listen. No one, and most people saw healthcare only from their own personal perspective, and were not able to generalize. You've had healthcare, but there are millions of Americans that don't. What is our responsibility to them?
I kept a blog, and early on I challenged the readers to have a conversation with someone with whom they knew they disagreed. And I think the only way someone can do that is that sense of mutual respect, which means when I start speaking, I trust that you won't start until I'm done. And when you're speaking, I'm gonna let you finish. And until you allow them to finish, you can't have a conversation.